the world is on edge. A virus, silently spreading among animals, has scientists deeply concerned. This isn't just another outbreak, it's a wake-up call. Bird flu, or H5N1, is no longer a threat confined to poultry farms. It has jumped to mammals, including cows, and even humans. The big worry? This virus is constantly changing. Experts fear it's only a matter of time before it learns to spread easily between people, potentially triggering a global pandemic. We've seen this movie before. Remember the COVID-19 pandemic? The devastation it caused, the lockdowns, the fear, the loss? We can't afford to be caught off guard again. The alarm bells are ringing, and it's time to listen. H5N1 is a type of influenza virus that primarily infects birds. It's highly contagious among them, often leading to severe illness and death, especially in poultry. While it's not easy for this virus to infect humans, it's not impossible. People in close contact with infected birds, like farm workers or those handling poultry, are most at risk. The recent cases in mammals, particularly cows, are raising red flags. This suggests the virus is adapting, potentially finding new ways to spread. In the United States alone, over 1,000 dairy cow herds have been affected since March 2024. The virus has also been detected in pigs and over 400 other wild animals. Human cases are also on the rise. While still relatively low, with over 70 infections in the United States, the first confirmed human death occurred in Louisiana in January 2025. This underscores the very real danger H5N1 poses. Leading virologists around the world are sounding the alarm. Dr. Peter Police, director of the Global Virus Network, calls H5N1 a top pandemic threat. He's not alone. Experts point to the virus's rapid mutation rate and its ability to infect a wide range of mammals as serious causes for concern. Dr. Mark Johnson, a virologist at the University of Missouri, warns that H5N1 is showing concerning patterns. He says the virus has many opportunities for adaptation, meaning it could easily evolve to spread more efficiently between humans. The possibility of a pandemic is not a question of if but when, according to many experts. They emphasize the critical need for proactive measures to prevent a global health crisis. Health organizations like the World Health Organization and the Centers for Disease Control and Prevention are, closely monitoring the situation. They're working with governments to strengthen surveillance, improve diagnostics, and develop effective vaccines. The United States, for instance, has a stockpile of about 20 million bird flu vaccines, which are reportedly a good match for the current H5N1 strain. The capacity exists to produce millions more if needed. However, the recent change in administration has raised questions about the future direction of pandemic preparedness efforts. Experts, however, argue that more needs to be done. They call for increased funding for research, enhanced biosecurity measures on farms, and better communication with the public. While the threat of a pandemic is real, there are steps you can take to protect yourself and your loved ones. First and foremost, stay informed. Follow reliable sources of information like the CDC and WHO for updates on the situation. Practice good hygiene, including frequent hand washing with soap and water. Avoid contact with sick or dead birds and make sure poultry and eggs are cooked thoroughly. The fight against H5N1 is a global effort. By staying informed, taking precautions, and demanding action from our leaders, we can work together to mitigate the risk and safeguard our future.